Okay, Ed, go ahead and start walking.
Already did.
And this is your 4th visit. And go ahead, turn around and go back one more time. And so what I'm interested in knowing is, where are we at 2 weeks after the first filming in terms of your ability to walk? I know we're treating issues throughout your body, but would you comment on your...
I'm doing really good. When I first came in, I couldn't hardly, it was hard to stand up, and I wished you had filmed me when I had to stand up and couldn't.
Yeah, going from sitting to stand?
Yes. It was, and I had to hang on to something.
Right, I noticed you tapping the wall when you would walk.
Yeah.
And you had to navigate the stairs. We have 3 steps and then 2 more coming in the house.
I had to hold my hands on the sides and the steps to get in and out.
Yes.
So,
and you also commented that you would get sciatica with each step. You would get a zing or something of sorts. That's not a medical term, but...
Go right down, kind of right down here, and the knee and on down.
Okay. And how is that behaving?
Feels really good right now.
Really?
Yes.
So on a pain scale, that sciatica would be rated a what before?
Before, I would say it was probably about a 7 or 8 for sure, and now it's probably 2, if at all. I mean,
Nice.
A lot of the times I don't even feel it anymore.
Very good. Well, I'm glad that that's holding at least two weeks. And we have not repeated the very same treatment that we did to gain that. We haven't had to.
All we've been doing is
Other stuff.
blocks.
Yeah. And the blocks are more for hip rotation.
Okay.
The pattern I treated there
Right.
has a different
Walking.
nomenclature. And no, we're done. You can stop.
Okay.
Yeah, the pattern that we found was that you had blocked pelvic mobility in all directions, except the right would allow some rotation, which was unique, having never seen that in someone else. And the whole pelvis was rigid throughout.
Hardly any pain going down my leg anymore.
That's wonderful.
It's very, it comes and goes, but it's pretty rare.
Interesting. Well, what we did was restored ability to translate through your pelvis, in my opinion, through the sacroiliac joint.
Okay.
And I'm not
It's still
saying...
a little tender back here, but
Very good.
But it's not anywhere like it was.
Yeah, yeah. And I'm not saying that I moved an ilium or a sacrum. So even though I use the word sacroiliac joint, I'm not making a claim to have changed the relationship inside that joint.
Right.
I am making the claim that I restored the ability of force transmission to go through the pelvic bones, as we demonstrated on that first video. And right now, sacroiliac dysfunction is becoming a new buzz term because the surgical manufacturers are pouring gobs of money into the advertising, marketing.
As far as I looked it up on the internet, and they were talking about some surgeons claim there's no, nothing can go wrong there.
Yes.
And other surgeons say, yes, there is. So they, according to that, they said that you had to, when you went to see somebody, one of the first things you ask is, do you believe in this or not?
Yes.
Because that's where the pain was.
Yeah.
So
And we're seeing more and more.
I didn't really get an answer.
True, true, and we're seeing more and more research coming out on that very subject.
Yeah.
And as a clinician, I'm very cautious about what I do with that structure and what I tell the client about that structure.
From what I understand of them, it doesn't move very much.
You are correct.
But you still have nerves that run through it. And
Not through it, not through
They don't
it,
go through
but in
it.
the proximity.
Oh, I thought they went kind of in through
No.
some of this area.
No.
And I would compare it to electrical wires where...
Yeah, they're nearby, and they have little fibers that do go to the
something.
ligament and to the joint capsule, but they don't, and they're right in front of that. They lay across the front of that joint, yes, and they go beneath it, but they don't go through that
I
sacroiliac
thought they
joint.
went through it. So
Yeah, you're thinking of the
my
sciatic
mistake.
notch. You're thinking of the notch where it does go.
Okay.
It might go behind or through the piriformis muscle.
Okay.
Yeah. But anyway, I'll stop filming here.
Oh, I didn't know you were...
Yeah, indeed. I just wanted to capture that. We have 2 weeks of benefit from that one treatment. And if I remember on the last visit, in 2 more weeks from now, we'll do it one more time. Thank you.
Okay.